Hi, everyone. Welcome to this great webinar. We are going to go ahead and get started just because we have a lot to cover today. We want to make sure we get time for questions and everything. So we just want to welcome everyone. We still have more people joining shortly, but we will go ahead and get started. So I want to just thank everyone for joining. Thank also to Strategicon Pharma, who we're doing this webinar in collaboration with. And with that, we're going to go ahead and just introduce some of our presenters for today. So the first presenter we have is Dave Cook. He's a Senior Director of Clinical Operations at a Cambridge-based biotech. Dave has over 25 years of pharmaceutical experience in clinical trial operations, including monitoring, site management, study management, data management, cross-functional communications. He also has experience in phase 1, 2, and 3 clinical trials, both domestically and globally, with over a wide range of therapeutic areas. We also have Farah Ahmed from Strategicon Pharma. Farah has over 20 years of contract research organization experience in both early business development, strategy and intelligence, marketing and operations, among a few other things. And prior to Strategicon Pharma, she was a Senior Vice President of Global Business Development, head for early phase at Syneos Health for the phase 1 and bioanalytical business unit. Farah has held prior roles in preclinical bioanalytical operations, business development at Charles River Laboratories, and as an independent consultant. And Farah holds a Bachelor of Science with honors in biochemistry from McGill University and an MBA from Concordia John Molson School of Business with a major in strategy. So I just want to welcome our presenters. And just to give you a flavor, I mean, I'm pretty sure you know what the webinar is about because you registered. But I'll just give you a little bit of a summary on what you can expect here on this case study we'll talk about today. So the global pandemic is accelerating an already rapid migration to digital technologies. Sponsors faced with supporting increased study complexity and rapid change have reported that their existing tools for managing budgeting and outsourcing processes for their clinical studies at unnecessary risk and delay. So today's webinar, you're actually going to hear the case study of a small biotech and how they demonstrated the ROI to acquire new outsourcing technology and gain decision-making maker approval. So with that, I'd like to pass it over to Farah and to a great webinar.
Thank you, Deb. So thank you everyone for joining this afternoon. We're really excited to share this case study on RFP automation with you. And I'm honored to be joined by David Cook today, who will be presenting the case study. So we're going to get going, and I'm going to start with presenting a couple of introductory slides and show a video and do some polls before kind of David starts the case study. I like to think of clinical trials as an orchestra. I think the metaphor is a good one. There are a number of similarities, and in particular, you have a lot of participants that must execute the plan or the sheet music correctly in order to have a beautiful outcome, which would be a wonderful piece of music. You also have multiple stakeholders, such as the audience and the participants. And you also have a leader, the Maestro, that creates a beat and provides some structure to the execution of the orchestra. So orchestrating a symphony is hard work. I think most of us can relate with this image. When you think about clinical trials, and in particular, the challenge a sponsor is facing, there are a lot of moving parts. Just as Deb mentioned, we've seen a lot of change due to the pandemic. We've seen rapid changes in regulations, the requirement to assess a lot of new technologies quickly, figure out how do those compare, which do we pursue, how do we buy those services, how do we measure performance in those services, and also how do we ensure that we're doing this on a timeline and we are synchronizing vendor input, partner input, and ensuring we are delivering upon the expectations of key stakeholders, such as your internal colleagues, your management, as well as investors, be they public or private. So all of this is certainly a very difficult task, and especially more difficult without the right tool set. Let's kind of shift now the focus to outsourcing in particular. We consider outsourcing as part of clinical business operations, which is the vertical that we here at Strategicon are focused on. So if you think about outsourcing, it's a time-consuming activity. You're looking at hundreds of hours to capture the complexity of a clinical trial in a sophisticated and accurate budget. You're looking at also hundreds of hours to conduct due diligence and ensure that the incoming bids and proposals that you're getting are representative of the assumptions you want to capture for your study, and that you're able to really understand those and compare them fairly. This is exemplified by the low technology environment in which we find ourselves. So typically, most of the industry and is reliant on the Microsoft Office suite and primarily on Excel. That continues to be true today. And while Excel and other tools are fabulous for many applications, they do represent static data points. This kind of static data points adds complexity to analysis, trending, storage of information. For example, if a colleague leaves the organization, they often take a great deal of intelligence with them, and oftentimes it's difficult to find that history back. You're also looking at another complex issue when it comes to budgeting. So when we think about how do different stakeholders budget, if you look at the sponsor side, typically every sponsor has created a bid grid that consists of tasks and categories that they name in their own way and they bucket in their own way. On the flip side, on the CRO and provider side, each have their own native costing tool that is inputted by multiple people at their organization, and they have their own way of categorizing tasks, naming those categories and naming tasks, and bucketing items. So really, we are kind of stuck in a situation where we are all speaking different languages, and that is what's generating a lot of the additional time needed to compare. So if you take a step back, really this is kind of an unsustainable situation. And we do have some kind of biases that are built in into the process, as well as some sense of lack of transparency using the current tool set. In addition, we also have disconnected processes. So when you think about the activities in the clinical business operations vertical, we're pretty much talking about kind of 3 or 4 areas of activity. Firstly, sponsors are generating a plan before the trial, before they are moving forward with a trial. And that model could be using an older study that, things have changed in the past. There could be fluctuations in inflation, in FX rates, and even in technologies in the way that the tasks are executed. So that kind of creates some flaw in terms of using historical data. They're also typically doing some kind of scenario analysis, and if they're not, usually that's a challenge due to the tool set. So scenario analysis is when you are trying to isolate particular parameters and understand how possible changes in study design or outcome would impact your cost and your timeline. If we now move to the sourcing area, as we talked about on the prior slide, this is usually an infrastructure that may have a different set of tools, oftentimes a different group that might be executing the sourcing that encapsulates outsourcing strategy, the process of engaging with vendors, selecting the right vendors, and doing due diligence on incoming bids. And then finally, once the study is awarded, you're looking at obviously many a continuous series of activities around monitoring the performance of the trial and the collaborators within that trial. This could be for many years, and we often call this kind of monitoring actuals versus plan, or accruals, or trajectory. This could be taking place in the ClinOps group, but it also could be with clinical finance or project management. So you're talking about a number of different stakeholders, each at times using their own series of tools, and a disconnect between these tool sets. To add an additional layer of complexity, when we think about clinical trials today, they are more complex than they used to be, and this is an ongoing trend. They are items like risk-based monitoring that depend upon the outcome of the trial, or kind of a certain stages of the trial. We're talking about many years trying to predict what could happen across 5+ years of a clinical trial. And all of this is we're trying to capture that, and we're trying to manage that complexity using tools that have been in place for 20+ years. If you look at other areas of clinical trials, such as operations, we have had major advances in CTMS technology and EDC technology, yet in business operations, we are still using static data sets. To exemplify this a little bit further, I want us to think now about succession planning. So of course, there has been some change in this data during the pandemic, but it remains that millennials are, in fact, the largest generation represented in the US labor force today. They represent more than a third of the workforce, and that is something that will likely not change. It will increase. So when you think about the new generation coming in, I think it is important to consider the training and recruitment of talent, the retention of talent, and how do we actually pass the torch to the next generation to allow them to firstly understand the issues in the market, in the clinical trials industry, and add value, and really identify with the tasks that they're doing and how that connects to the success of their organization. So I thought of sharing a little video here in the spirit of some fun to demonstrate this point. This is an excerpt from Ellen, The Ellen Show. I'm going to play it in just a second. And essentially, she is inviting a millennial to use some old technology, starting with folding a map. The second challenge is to look up a business in the yellow pages. And the third challenge that I'm going to show here is actually dialing that business using a rotary phone.
Okay, trying to spin. Okay. No! Oh my god! Okay, I just spin it to the 8. And then to the 1. 8, 1, 8. There's a lot of 8s. 8, 4, 5, 0. Hello. My parents are probably so disappointed. No. Oh my god. Oh my god. That was better than I could have ever hoped for.
Okay, going back to the presentation, hope you enjoyed that. We're shifting now back to the slides. So hopefully this exemplifies really, if you step away from it, really what are we asking kind of the new entrants to this industry to do, and can we make it more effective in terms of giving them or digesting information to allow them to focus on analytics. All right. What about the CRO perspective? So certainly providers are, their voice is of equal importance in this conversation. We did a survey back in 2018, and we asked the following question. We asked them to rate their current costing tool across a number of elements. When you think about a CRO costing tool, it is typically highly complex, 40 plus tabs, thousands of algorithms, and multiple people managing that tool. And these were the kind of the results of that question. So we do see that there's definitely some frustration around the ease of use, around the security. People can kind of walk out of the building with this tool that contains a lot of sensitive information, the reporting capabilities, and the potential for inaccurate information through broken links, for example. So this issue does actually exist across into the provider sphere as well. And hopefully we can provide some solutions to improve. So can technology help us rebalance? I believe that it can. I'm going to ask a few poll questions before we shift this over to Dave. So if you can get ready to answer a few poll questions, we're going to start with asking you to select your current organization or role. We'll give you a minute here. Still quite a bit of fluctuation. Okay, a lot of responses coming in. I'll give it a couple more seconds. This is fun to see it live. Okay, we're going to end here, and it's showing about 48% of sponsors, and seems like it has disappeared, and quite a good representation of technology service providers and consultants as well. Okay, well, on to the second poll question. I'm going to start that. And the question is, do you have experience using software for clinical business operations, study budgeting, outsourcing, forecasting, and if you're a CRO, digital costing? Some responses are coming in. The second one should be have used such applications and not sued. Apologies for that typo. Okay, so it looks like the majority is a combination between yes, we have used such applications in the past, and no, I am considering or exploring adding this technology. We're going to have one last poll question. Deborah, I can't not. Oh, here we go. Last poll question is going to be around, why do you think clinical business operations technology is not more broadly adopted in our industry? Love to hear your responses on that. Pretty interesting result coming through here around prior tools were expensive and hard to use. Oh, maybe I'll give it a minute here. Okay, well, quite a variety of responses. So pretty, I'd say, an even distribution, with the largest being the industry is slow to adapt to new technologies, second being prior tools were expensive and hard to use, and the third, disruptive technology is hard to sell internally, and the fourth, it's new and unproven. So hopefully Dave can address some of this in his talk. So we are going to have one more slide here before I hand it over. So there are a number of tools available on the market in this space. In particular, we're going to be talking about Clinical Maestro and the harmonious solution that it does provide through its fit-for-purpose SaaS platform for pharma and providers to come together in what we call a transaction room that permits a high degree of transparency, bid standardization so that you are kind of automatically mapping, and the ability to really focus on what counts, which is the dialogue. How do we ensure that the trial assumptions are correctly captured and that we are bidding with that in mind, and that we are correctly representing the needs for the trial to be executed well. So thank you so much, and I'm going to pass it over to Dave.
Thanks, Farah, and thanks, Deborah, for facilitating this, and thanks for letting me share my story a little bit here, and hopefully shed some light on the decisions that we made at my current company and my current situation to utilize the Clinical Maestro system. It looks like from the polls that a lot of you are sort of in the same situation that I'm in. We are where I currently am right now. We're a small biotech company, and we were charged with getting our first study off the ground within 1 year with no infrastructure, first in human, first in class, first in technology, and like I said, very little infrastructure within the company. So it created quite a challenge for us to figure out how we could go about it. Some of the other challenges that we had is that I was being employee number one in the clinical group. Clinical operations was a big education effort to not only with my team, but also with the internal management team, and just to get buy-in on what the advantages of using a system like this would be, as well as understanding the whole complex arrangement of tasks that needed to be undertaken to get a study off the ground and study startup. So I was able to, as a part of first getting off the ground, we were able to bring in some consultants, some pretty high level consultants that really helped build a depth and bench to help get things done. So one of the things we would consider is what can we do to help get us started. So we were looking at some technologies to help with the bid defense process, or to the vendor selection. Looked at that, and as many of you know, that when you're on the clinical operations side of the business, you get RFPs back from various vendors. They're all in their tools, and trying to compare an apples to apples comparison to be able to make an informed decision is often a challenge, because I think I can say without fail, is every CRO's proposals come in a little different. So the other challenge that we had facing was that given the study timelines that we had, and I'll say the short amount of time that we had to get started, we really needed to get our RFPs out before Christmas. And we had very little time to actually make the decisions to get moving. So it was quite a challenge undertaken. So one of the people that I was able to bring on was an outsourcing professional. He had several years of experience and had done a significant amount of research into looking at a tool that would help us get to this space, because you have to remember we had really no infrastructure in place. We didn't have a bid grid to even begin with, and developing that would be quite onerous. So after his research and digging into this a bit, we determined that the Clinical Maestro system was actually a really fit for purpose solution for us. It provided a lot of infrastructure around tasks and services provided in the CRO space, and it really put structure into a decision-making process that would have otherwise, in a small group that didn't have a whole lot of background in working and making these kind of decisions, put a lot of structure around that, which ultimately facilitated us, gave us the ability to make decisions. So we we as a clinical team came together and said, the system is really, it meets all of our criteria and will help us significantly because it has all of the infrastructure that we needed in place that we didn't then have to build all on our own with limited resources. So even though we were aligned as a clinical team, it still took a fair amount of internal approval. When we started the process, we had originally had buy-in to go look for this process or look for this software or service, and but along the way, the questions kept coming up, and we kept having to educate the management and kept educating even up to the C-suite. And ultimately, we had to do a presentation in front of our ELT to determine why, or to convince them why this was actually a good spend of the money. The way we would use the system would be value add, and and reiterate and re-educate on the purpose of the system and how it would help facilitate. So once we ultimately got approval and got the contracts in place and got everything signed off and ready to go, we were off and running. This is a full credit to the Maestro system, as well as the support that they provided for us. We were able to get the system up and running once we had approvals within a week. The system out of the box was very intuitive. I think we implemented it the week after the Thanksgiving holiday, and we had our proposals out before Christmas. The system itself is built with a logic that is very intuitive to what you would think about the decisions and the services you needed and how you wanted to organize them around that thought process. So it was very intuitive to use for us. Our team was 2 of us, which may also have something to do with why we were able to implement it so quickly. But given all of the infrastructure that's built into the system, it saved us, weeks to months of time for us not to have to develop that. So the infrastructure that the system provides was huge for us. We utilized, as you can see the list on the left, we utilized a lot of the basic infrastructure in the system. You're able to provide a RACI of who you expect doing what, which helps drive sort of the proposal process. It has a built-in bid grid, so the CROs were able to put their costs into our tool. It has a dedicated RFP template, so once you get everything all set up, you just hit one button and off it goes to the number of your vendors you go, and it's a consistent tool, so everybody's answering the same questions the same way. The scoring criteria, so it gave us an objective way to analyze the data that we got back and the costs. It gave us an objective way internally, cross-functionally, to give expectations to the team that had never done this before internally, the ability to have a set expectation as to where the decisions were going to need to be made and to score them accordingly. So, one of the obvious questions that we had was, what would the providers think? Because as you guys are probably aware, at least those of you on the sponsor side, all of the providers want to do things in their way and provide it to us and force us to have to actually, mold to their system. Given our size and our need to move quickly, we didn't have the luxury of time, bandwidth, or resources to then collate everything into a consistent bid, make apples to apples comparisons. So what we did was we ended up forcing, for lack of a better word, our providers to work in our system. And we took a pretty significant stance on that because for basically the bandwidth reason is that we didn't have time or the resources to actually do all of the comparisons. So we told the providers if they didn't want to work in the system that it would take them out of the running. In turn, we actually did have one provider that said that they weren't comfortable working in our system, and we ended up not using it. So We originally had identified 5 vendors, ended up going with 4, and all the other vendors were able to, and we're happy to work in the system. That said, we did a protracted timeline to allow the vendors to have more time to get trained in the system and understand where the inputs were needed for different costs and different tasks. But the folks at Strategicon were able to provide really, I would say, top class customer service and one-on-one trainings and support to the providers, to us, and everything like that. That made the process a lot easier to swallow and a lot easier for the providers. And for us, at the end of the day, it made it a lot easier for us to analyze the proposals that we got in, and it streamlined the process tremendously. You can see in the 4th bullet down, we were able to get the bid defenses in, and the way the tool is set up, and I think there's a screenshot on the next slide, it gives a very easy comparison to be able to say, service provider 1 and service provider 2, this is how they're answering these questions. And it made it super easy for my team internally to be able to make a decision. So much so that as we developed the program, we thought the tool was so valuable for us is that we started retrofitting it for all of our other vendors and service providers that we needed to get the study off the ground. We did our IRT there, our EDC selection there, central labs, drug depots. I think that's it. We used the Maestro system to allow us to get our proposals and make our decisions based on that. So like I said before, some of the infrastructure that the system builds in allows for a consistent message to your internal team, even if they haven't been involved in this vendor selection process for clinical services. The infrastructure and the system allowed for easier decision making. It enabled the cross-functional team to actually make decisions and score things accordingly. And then ultimately, the system worked so well is that one of our biggest critics in the beginning and not understanding why we needed the system, actually once we got in, used the system, showed them how to use it, got the information and data back, and able to make it an apples-to-apples decision. He actually came back and was very complimentary of the system. Was like, this system is great, So it was very satisfying to actually get the conversion from our biggest critic to our, now one of our biggest allies. So this is just a screenshot to kind of demonstrate sort of how the scoring system works and how you can compare one vendor to the next. This is also, as you know, with proposals, there's lots of text and explanation, team structure, what have you. That's all built into the system, and they can provide it. And the great thing about the system is you can organize, or it becomes organized that you can say, I want to compare the organizational structure from CRO 1 to CRO 2, and you can get them side by side on how they've entered it into the system, and do a real comparison. I mean, we had, like I said, I think we sent out 4 proposals for CROs. We whittled that down to 3 very quickly, given that we had this tool in place, and then we're able to make the decision very quickly. I would say we probably shaved 2 months off of the timeline for us internally. I think this might be my last slide. I would be remiss if I didn't talk a little bit more about the service that was provided. As a part of implementing any new system, if people aren't comfortable with the system, if it's hard to use, if there's not support there for when you have questions, the system will start to fade away and not get used. At least that's been my experience. The team at Strategicon, when implementing the system, also provided you with an implementation specialist or a support specialist that was with you pretty much every step of the way. And even to this day, when we started this process, it was last October, late October, early November. And I feel like if we called our support person today, she would be on the phone and call us back within a day and understands, or within hours sometimes, or minutes, understands our process. The professional experience and background is in the outsourcing space, so they understand what we're trying to do. So it's not a random support person, and that they understand, your company and your efforts and what you're trying to do and what you're trying to get across. They also gives us an advantage when working with our service providers is that because they understand our process, they are able to work with the service providers and help them sort of manage into the system as well. And this was exceptionally advantageous when we were trying to dovetail the system into like our depot selection or our IRT selection. So it was hugely helpful. So, just to kind of give an overall impression, I feel like I've come across that. I'm a big proponent of this system. In my situation where we have a limited number of staff available and we're really focused on execution of the trial and getting things up and running and starting the trial, having the infrastructure software in place where I didn't have to build the infrastructure internally was hugely advantageous. So, like I said earlier, I feel like we shaved about probably 2 months off of the process. It enabled sort of cross-functional consensus building on my team. As you can imagine, if you're trying to build sort of this infrastructure internally, whether it be through an outsourcing group or a business operations group, or at least 1 or 2 people developing a bid grid and developing all of the structure that you need to support service provider selection and vendor selection. It's a big undertaking. And so, within weeks, I have 2 weeks in here, and I feel that that's probably accurate. We had already paid for the system with just the efficiencies that it built in. And like I said in my last slide, that the customer services and the ability to help implement the system was top notch. So I think that's it on my slides. I'm a big proponent of automation in this capacity, and I feel like the tools really helped. So hopefully this was helpful for you guys, and if you have any questions, we're here to answer.
Great, thank you, Dave. So if there are questions, we're going to shift to questions. Deb, I'll kind of hand it back over to you for the questions. But I will say that for any additional information on Clinical Maestro, either from a sponsor or provider perspective, or if you'd like to view a demo, you can always contact us at info@strategiconpharma.com. So plenty of time for questions, and I'm really happy about that. Go ahead, Deb.
Sure. Thank you so much, both Farah and Dave, for that. We do have a couple questions that did come in. So we'll get to some of them. We might not be able to get to everything, but we will give it a good try. So number one, someone asked about ballpark costs. So, I'm sure this is perhaps not something we can share right here, Farah, which is something maybe they can get as they, contact you guys directly. But the other piece with that ballpark cost question is also for Dave. What methods did you use, to gain that approval internally for that investment cost with the new technology? So if you can share anything on that.
Sure. I had to get myself off mute. Sorry about that. I will say the cost was not prohibitive. It was more of a sales, and I use that term loosely, pitch of getting the internal stakeholders and the internal decision makers in finance and legal to say, this is something that will be helpful to us, and that we would need to provide, and having to sort of explain and educate and re-educate on the process for what this service would provide and the value it would add. Once we got into using the system and utilizing it, it became very obvious that the cost, or I'll call it ROI, was well worth it. I don't know if that answered the question or not, but mostly it was an internal sales and conversations with stakeholders, half-an-hour meetings to discuss the process and what this means and and sort of the pros and cons. What if we don't do it? What if we do it? Kind of thing.
Sure. Perfect. I think that does. But again, if you want a little more information, you can contact directly Farah for that information. Another question has come is around the CRO feedback. If you got any feedback during the process with the CROs, if there was any feedback there on using the system and their experience too.
Yeah. And yes, the short answer is yes. There's definitely a lot of feedback. Most of it I will chalk up to that the CROs have and this is just my own personal experience, so take it with a grain of salt, is that the CROs have their way of doing it. And if you go with some of the bigger CROs, there seems to be, in my experience, a little less flexibility in the way they operate and the way they can provide proposals. So but once we explained our situation, where I was essentially an N of one with a handful of contractors, that I really needed the infrastructure to be able to provide an apples-to-apples solution. Like I said, all but one, and that one that didn't want to play happened to be one of the big players. And not to say that the big players wouldn't be in, because we've used big players. There were other big players in the decision process, but there was a little bit of struggle in the beginning. But once they got used to the system and once they understood what we were trying to do, with help from the support team and how to answer the questions, everybody seemed to be okay. We had a little bit more struggle, if I'm being completely transparent and honest, with some of the services that weren't specifically, dovetailed into the system, like labs or IRT, but it worked, and we figured out how to make it work, and we just provided feedback and training to the CROs to allow them to work in our system.
Excellent.
So hopefully that helps.
Thank you. Another one that has come up, so for Dave, and then I have one from Farah. How was the original timelines for RFP? And the question was how you calculated ROI as well. So it might be tied into what you answered. But the first part of the question is, what were original timelines for that RFP?
So just based on experience, I've usually given 2 weeks for vendors to get back to me with a proposal, understanding where we were and what we were doing for this one, because we knew we had to get a CRO up and running and on board very quickly because of the nature of my trial and complexities behind it, and that I needed some just bodies to help do the work. We needed them up pretty quickly. But we ended up giving 3 weeks, which was completely fine. And everybody was able to get into that. Now so hopefully that answers that part of the question. Regards to calculating the ROI, I would say that's kind of a soft measurement. Certainly would have been doable if the cost of my consultants, the cost of their time, the amount of time it would have estimated to take to build a bid grid, and so on and so forth, and just the speed at which we did it compared to what it would have, and to do it with the system and then to do it without the system, and then just calculating out that cost is what I would have done had I had to do it. But again, like I said earlier, the cost of the system was not prohibitive, but it paid itself back pretty quickly. Awesome.
So actually one more, Dave, and then I'll jump one to Farah. What was the approximate size of the trial, or CRO agreement? So what was the approximate size of that trial that you did this on?
So it was a phase 1, first in class trial, but it was inpatient. So it was a very sick patient population and rare disease. So without giving, I see the question is, was it $500,000 or $5 million? It was over both of those. So it was not an inconsequential trial size. It's very complex and a very sick population.
Excellent. Farah, for you, and then I think we have one last one for Dave. What other services do you provide in terms of post-contract award and things like that? Track units, if they're completed, and EA, do you guys have something around those areas?
Yeah, we recently released a third module of Clinical Maestro that is called LEAD. It's a LEAD application. So this is a modular system. You can actually add functionality as your needs evolve, your organization needs evolve. So the LEAD module is using a very similar interface as the sourcing module. It allows you to convert your selected or your awarded bid into a contract right within the system and invite your provider or vendors, let's say all the vendors participating in that award contract into the system to report their accruals and forecast their units. And what is interesting is that it restricts the ability to change, let's say, the unit price. So it does provide a good kind of structure for the accrual process and the earned value analysis. And it also enables that comparison back to plan so that you can quickly see if a change order is going to be needed kind of around the corner. And if the trajectory is not in the area that you, or in the direction that you want, you can have a very transparent discussion around what will be needed to actually shift assumptions and forecast a recovery. So really a very powerful tool called LEAD, and happy to show that to anyone who's interested in a demo.
Awesome. We have two more, Dave. It's all coming your way, Dave. So one is, so the person's asking about what's the basis for the comparison. So, you said that there was sort of a comparison apples to apples. So how is that, how are you able to do that in the system when a lot of the responses that actually come in from different CROs are quite variable?
It's a good question. So because the short answer is, so we've sort of mandated the questions be answered in the certain areas where they needed to be answered. So you didn't have to go hunt and peck around the proposal to find the answers or other hidden variables and hidden costs. So by sort of, I feel like the system is strong enough that it allows you to sort of intuitively understand where you need to answer which questions. At least that was the way it came back to us from the user's end. So there really wasn't a whole lot of hunting and pecking around. That said, the way the tab structure in the system is set up, it's very easy to go around, and if they might hide it, or I won't say hide it, but if they might enter the data in some other system, it's pretty easy to go find. And then the other thing about the comparison tool, and Farah, correct me if I'm wrong, I think it's all print outable, so you can kind of look at it on paper if you're that kind of old-fashioned person, but it was so easy to use in the system that we didn't really print them out for anybody. I don't know if that, I hope that answered the question.
Yeah, you can export to Excel or PDF.
Excellent. I know that's great. And we did have a question, and maybe Farah, you can jump in for this one, is about if the system is easily integrated into other systems like financial ERP systems.
Yeah, that's a great question. So yes, in short, the system first of all, it's new technology. So it does actually integrate. We do API system to system integrations. It integrates quite well. We have a number of integrations kind of already in place. Certainly when we talk about ERPs, financial systems, CTMSs, those are usually particular to the sponsor's environment. So we don't necessarily have those integrations off the shelf. We do have an integration with Okta, for example, available, and we are working on another integration with a major CRM system. So definitely some integrations are possible, and the idea is really to think about your landscape of applications, think about efficiencies. How in an ideal world would you like to bridge all of your data flows? Where do you want data kind of coming into the system or pushing out of the system? And I definitely think that it's a great question and an item that sponsors should really think about for maximum efficiency, how to get the most seamlessness across their landscape of applications.
Excellent. And I think we have our last two questions. We are coming short on time. So the last two here, Dave, maybe you can answer this first one, is what were the benefits do you feel of the retrofitting that you mentioned of the other vendors into the system? What did you see as a benefit to doing that?
Sure. For us, it was just a consolidated sort of repository for their answers in their systems. I will say that there was a little more variability in the way that those were answered because the system, I mean, while it's built for that kind of service, it's not specifically built for that. So some of the questions were answered in different places. But again, the tab structure and the way you enter it is, it lends itself to being able to find the information you want easily. So for us, again, it was just a central repository for information so we could do a simple comparison quickly, because still, I mean, as I said earlier, this whole case study, didn't know it was a case study when I started, but started in October and it's still evolving. So it's, helping us, and my organization is not that big. So this helps me have a single place for my team to go.
Thank you. And with that, we'll make it probably the last question, unless there's another one coming in. Dave, you mentioned the benefits about the system for a small organization as yours. The question is, what benefits do you think large organizations or teams could have with this system? From your perspective, because I know you have years of backgrounds in very large organizations as well. So
right. So I'll give you my clinical operations perspective on this. Having a tool to use that consolidates all of the information that you need to be able to make a decision, and many times a very expensive decision, in one place is very effective. I've been in big organizations that didn't have any tools except a person that collated all the answers and put them in a spreadsheet and then identified the associated costs. So I think even in a big organization, having a centralized tool is helpful. Now, I'm not the expert in these kinds of systems, so I don't know how many other systems there are out there that do this. I do know that my colleague in the outsourcing, who sort of made the handshake between us and Strategicon, did a fair amount of research and determined that really the fit for purpose for us and the services that we needed, this was the right tool to purchase. There are, as I understand it, there are other tools that have some of these capabilities, but as I understand it, none that have all. But again, I'm not really the expert, but I think that just in my past experience, having a tool is beneficial in larger environments where they are often homegrown. It's been my experience.
That is great. And if I can squeeze in a last one, I know I've said that 3 billion times, but really last one, it's 157. So did you feel, Dave, that in the side-by-side diligence that you've done in the system resulted in a higher negotiated savings versus, let's say, if you use just, your traditional Excel and, hours of manpower.
Yeah. So, in all fairness, I mean, given our experience on the team, we did a lot of negotiations based off of years of experience. So it would be hard for me to say that the system really helped me negotiate or drive down costs. I could see the other part of the system that's very valuable is the benchmarking data that is in the system. So it gives you a ballpark price as to what to expect. So it did enable me to have that data to be able to make an even more educated decision, also as aside from based on experience. So, but in fairness, we did also extract the information and look at it the numbers wise and say, does this make sense or doesn't make sense? And that we did in the old fashioned Excel.
Well, that's great. Well, thank you. I think we got to the majority of questions at this point. We will have to log off, but want to thank everyone for joining. Thank also to Strategicon and to Dave for sharing your experience and this case study, very, very real information. And so we thank you. And again, if anyone wants to contact Strategicon for Clinical Maestro demo or just more information, ballpark costs, things like that, we have their email on screen, or you can reach out to us at ClinBiz. Happy to have you guys all, and I hope you all be able to join us next time. If you missed any portions of this webinar, you've registered and you'd like the recording, please do send us a note at info@clinbiz.com, and we will get that over to you once it's available. All right, thank you everyone, and hope you have a great rest of your week.
Thank you.
Thanks everyone.
Thank you. Have a great day. Bye.